Happy first day of 2026. Get it. Okay, make your goals. Pick your word for the year. I'm still debating on mine. It's like waiting on God. Commitment, like follow through. Or like last year it was like peace, but I think we got there. Maybe boundaries? Something like that. Anywho, I was just thinking about I'm coming to pick up a new desk that I got off Facebook Marketplace. So I'm here at this apartment complex waiting for the guy to get out and bring me my stuff. But I was driving past the dentist that I had, who took out my wisdom teeth, and I wanted to share this story time. So I currently work for an oral surgery practice now. And, you know, you learn a thing or two. You're like, oh, I did not know that. So driving past my old dentist. Yeah, my old dentist. So there's levels to it. So you know how there's doctor, there's dentist, there's orthodontics, there's endodontics, perio, and oral surgery. If you didn't know that, so perio is like all your gums and stuff. Like a couple years ago, I had like really short teeth. I grind a lot, and so a lot of my length is like kind of gone. You can kind of see. This one's longer than this one's because I grind. So I wanted to lengthen my gum because I have kind of a gummy smile. So I went to perio and they cut it. Yeah, you get longer teeth because your tooth root is really, really long. So they just like made sure that I had enough bone and they cut it. Endo, I'm still learning, so I don't know what endo is. Ortho, it's braces. All they do is braces. That's it. It's kind of the limit of what I know on perio, but so it's dentist is at the bottom, is like the bare minimum, and then you can go into a specialty of perio, ortho, endo, and then at the very top is oral surgery. Oral surgery is like 14 years of schooling instead of 4, like a dentist, because they become an MD. Sometimes they go through that and they actually get it, or they don't, but they still have to go through that training because you're working with the mouth. So now you're working with the bone and the nerves that go into the bone, right? I didn't know that. So when I went to my dentist, I got my 3 wisdom teeth taken out, and I remember it was just a horrible experience. And everybody says that, like when you get your wisdom teeth taken out, you become a chipmunk for 3 weeks. It's super painful. You can't sleep. So when it happened to me and they only took out 3, I was like, why don't you take out all 4? Like, no, you don't need to take out the other one yet. And I was like, all right, okay. Like, I don't know any better. Now I know better. But at the time, that's what they did. They took out 3. I was in horrible, horrible pain. Okay, my mom took me. She speaks Spanish. So I love her, my mom, but she probably didn't get the instructions right. Now, when we let patients go after their oral surgery and we take out their wisdom teeth, which is, kind of everything that an oral surgeon does, like primarily like implants, taking out infected teeth, figuring out if you need more bone, or super basic because everybody has to get them taken out, the wisdom teeth. So I go to this place. I have a horrible experience. Like the first night, I got dry socket and I had no idea, which is an infection in the tooth, in the socket. So I don't know what I did, but the blood clot came out. I must have sucked down a straw. I must have spit. I must have something to dislodge that. And so then I got dry socket. And after 3 days, I was popping Vicodin every 3 to 4 hours in the middle of the night. So the pain would hit, have to wake up, take my medicine. I remember having the little lamp on and just like waiting until the pain could go away. And then I was able to fall asleep. And then the same thing in the morning. And it was like, the guy came real quick. Oh, shoot, not big. Okay. I'm using my husband's car right now, so it's not exactly. We'll make it work, okay. So back to my story time. So I went to that dentist. They did it. I went back and they put something in and fixed it. And they were like, oh yeah, you got dry socket. And within seconds of them putting in whatever medicine they did, fixed. No more pain. I was like, bro, what the heck? This guy's getting rid of that lamp. Kind of want that lamp too, but I don't know. You gotta be careful when you buy stuff online, because sometimes he did leave it. Oh man, I gotta ask the Holy Spirit, because sometimes they come with things. No, I don't want the lamp. When people have things and they do things around their furniture, it's okay. You know, they can have spirits attached to things, and so when you buy secondhand stuff, you have to be careful, and you have to like pray over it, you know, just to be safe spiritually. But I mean, you're not gonna do that for like a cursed item. Like, I'm not gonna get like a, you know, clothing from a witch, or somebody who's gothic, or somebody who's like, you know, LGBTQ, or who else wouldn't I get stuff from? You know, just someone that I know whose life and practices do not align with mine, because spirits of confusion, spirits of fear, spirits of stuff like that is attached onto their items. That's why, you know, in the spiritual realm, witches and warlocks, or people who aren't doing the right thing, they'll get a lock of your hair, because these things are symbols of you, a representation of you in the spirit realm, and that's why they can do spells and curses on you from far away, and you're like, what the heck is up, you know? So you have to be careful when you buy stuff. I'm getting a desk, and I already prayed over it, even right here in the car, because I do not want anything coming in that isn't up. And you know, sometimes you just don't know. Maybe they're doing drugs, maybe they're into pornography, maybe they're doing something that they shouldn't be doing, and now you purchase their item and it's causing chaos in your home. So you also have to be cognizant, like, okay, my husband and me are now fighting? What? And like, me and the kids were having issues? Like, oh no, spirit of division, you know? One of the biggest tactics that the devil does to break up families is divide and conquer. A house divided cannot stand. So, you know, just when you buy stuff, like, you know, look out for that. So anyways, back to my story. So that was when I was like, what, 23? No, I must have been so much younger, because I had TRICARE Dental through the military. I was still in the military, but I wasn't married yet. So I must have been like, even, yeah, I wasn't married. I was completely single. So maybe 19, maybe 20. Dang, that's crazy. Anywho, you know, so years later, so what? Now, fast forward, I'm married, I have my daughter, I'm working at Loma Linda University, the School of Dentistry. It's so funny, School of Dentistry. You kind of see how God kind of like is in your life, and things kind of repeat, you know? Those are his little guiding posts for you on where you should be and what you should be doing. Anywho, so I was at the Loma Linda School of Dentistry. Loved that job. Across the way was the oral surgery like department, and because I worked there, it was only $20. So my top right, I guess, was impacted, which means it's coming in sideways. I have a small jaw, so I just thought, oh, okay, now I gotta do the fourth one. Like, all right, it would have been nice to just get it done back then and get it over with, but I have to do it. Luckily, because I worked at the School of Dentistry and the insurance was really, really good, and I mean, it was students practicing on me, I only paid a $20 copay. That was it for my anesthesia and whatever. And if you've ever had wisdom teeth taken out, it's like thousands of dollars, or depending on your insurance, how much they cover, it could be like a couple hundred, or it could be like $1,000, $2,000, because the insurance coverage isn't that great, or you don't have a lot. So the guy, I remember I asked, I don't who's a good resident? Like, who knows their stuff? And I remember the residents that were really good in the prosthodontics, which is the department I was in. They were like, oh, go with this guy. And I was like, say less. So I go with that guy. Beautiful, easy. I went to work the next day. I think I only had that day off, which was a Friday. I took Saturday and Sunday off and went back to work on Monday. Too easy. So it was a good experience. So now, fast forward, I'm 38 years old. That was when I was, my daughter was like 1. Yeah, I remember it was going to be her first birthday, so she was like 1. So this is like maybe, like more than 10 years. And I'm working at this place, and I'm seeing these kids, and the doctors, when you work for doctors, you have to learn their lingo. And because I came from medical, like my background is predominantly geriatric medical, like nursing home, hospital discharge, case management, making sure they get placed, Medicare, Medi-Cal. And if you're in the rest of the country, Medi-Cal is, we're Californians, we call it Medi-Cal, you guys call it Medicaid. I know, I learned that one at a HMO I used to work at out here. Anywho, so he was teaching us so that we knew how to, like, I'm the marketer for them. It's a public relations coordinator. So I'm the marketer, and he's teaching me because I don't know anything about this stuff. And he's like, oh, like the bone. And he was explaining how some dentists, because they've been doing it a long time, they get real confident. And they call them super dentists, like when you're in the industry. And some people know they could be like very seasoned dentists, and they'll start doing extractions, and they get really comfortable. I mean, it's experience, right? Like, they didn't go to school for it, but they got the experience of it from working on hundreds and thousands of patients, probably hundreds of thousands of patients over the years. These really old dentists that they know how to do extractions, so they'll be able to pull out wisdom teeth, but they shouldn't be, because of the training that they didn't get. They didn't go to school for that. But as you know, you got the experience. So, like, I mean, I was a combat medic, and a lot of us, we're over here giving out medications and like treatment plans and like medical advice, but they're just like a little EMT. But through experience, through stuff that you go through dealing with different patients and different scenarios and situations, you become experienced, you become really seasoned. So that's why in the military they'll call you doc. I'm not a case manager, but I've done the case management part of it. I have discharge. I digress. I'm talking too much. So my dentist took out my wisdom teeth, but they weren't really supposed to. And when they're very inexperienced on how to take them out properly. So you ever buy something from IKEA, try to build it yourself, you don't follow the directions to a T, and then it comes out all truckled or all messed up or bent, or you screw too tight because you didn't know that there's you're supposed to screw everything in kind of lightly, and then toward the end, that's when you do the final torques, because you can mess up the wood, and it's, wood that's fake wood, so it'll crumble and fall apart. Well, you don't know that unless you've done it a couple times and you've messed up and you've made it a point to learn to do it the right way. So that's what the dentist did to me. I don't know who it was who did it to me. I just went into the office and they just told me I was going to get it done. So who knows if it was my dentist or if it was a traveling oral surgeon who comes into the office twice a month, which is very common, and then they do the surgeries. Well, I got it done, and also having worked for a plastic surgeon, I've learned the techniques on things. Precision is key. So if the doctor is precise and cuts well and sutures up well, hardly any trauma to the tissue or to the bone, which means the post-op to be fantastic because you're not going to have a ton of swelling. You're not going to have a ton of like they don't go digging, you know, they don't like bust the wood, you know what I mean? So for me, the guy must have, or the girl, I have no idea who did it on me, honestly. They were like up in there, and it could have been me, it could have been them. I don't know how I got the infection, but they were clearly inexperienced because it was pretty bad. I had facial pain and swelling for like 3 weeks. I was like a chipmunk for like ever. I lost 10 pounds. I remember it was like going on a month until I felt better. And my family was like, oh, mira, bajaste de peso. I'm like, okay. And I was like, well, you know, all I could do was eat Jell-O and freaking oatmeal and mashed potatoes. Like, it was really hard to recover from that. And so when I got it done at Loma Linda, I was like, and this was impacted. It wasn't like a normal, when the tooth sits like this, you know, you can cut it in half, pull it out, or you can, boop, you know, pop it out. Mine was like this. So they had to cut into, so it was more complicated. And so this doctor's teaching me, and I'm like, dang. So, and it started clicking like after a while, and I was like, oh my gosh, they could have taken all 4 out, but they didn't, probably because the doctor or the doctor female, whatever, was inexperienced, so they only did 3. So that would have been more trauma and difficult on my part for me to go through that again, a second surgery. And the trauma that I had to do, and like recently I had to get something done where I had like in this back molar area where the wisdom tooth had gotten taken out. Like for the last few years, I just didn't pay attention to it because I didn't notice it as much, and 2, I didn't know what I know now. So it was like a flap over from the gum was flapping over a little bit from the back of my mouth. Like this is the back of my mouth, and it was kind of like doing that over my tooth, and maybe it got stretched out because I was, you know, I chew and grind. I have, you know, issues with my jaw sometimes where I'm like grinding in my sleep. So I guess it kind of got elongated and like kind of flapped over. Well, that flap had a pocket, and it was getting in like stuff in there, and I would do my best to clean it out and brush really well back there, but every couple of, you know, months throughout the year, it'll just like irritate me. Now the reason that's bad is because that's an ongoing infection. Now most people don't know this, but when homeless people the reason they act so crazy and stuff, sometimes it's the dental issues that they have. They don't brush their teeth, they don't have good oral hygiene. That can cause, you know, abscesses, infections, and that stuff. You're right next to the brain, dude. Like, it's gonna travel up, and it's gonna affect your cognitive, like, response time, your logic. You can become delusional, delirious because of the infection. So it started hurting, and of course it was over Thanksgiving week where it got the worst, and I had taken the week off for vacation. So I went Monday morning, that weekend I went to the ER because I was like, what is up with my mouth? I think it's this flap. And they were like, that's dental, we're medical, we're hospital, we're not. And I was like, and I made sure that I called around because I've worked in hospitals and dealt with hospitals. I was like, hey, do you guys have an oral surgeon on call? So certain hospitals that are big enough, they'll have somebody on payroll as a, you know, on-call doctor. And they'll call them and be like, hey, we have somebody, we need you to come in. And then they come in. They said they did. I called around and they said they did. So I went the day after Thanksgiving. It was like that Friday or Saturday. Nobody was open. No, and all these dentists, they were like, I had to use ChatGPT. I was like, okay, these are my symptoms. This is who I work for. And, you know, God bless ChatGPT. It was telling me that I had like this specific thing where it explained the gum and how stuff can get in and cause infections long term, and so that I needed to get it cut. And it's something that dentists can do, but everybody was, it was Thanksgiving weekend, nobody was open, so I'm over here suffering. And I was like, well, what is it that I can ask for them to do so that I can get through the weekend until I go to work and my oral surgeon can do his stuff on me. And they're like, well, they could probably prescribe you antibiotics and painkillers. That'll get you through the weekend. But right now they can also do a nerve block, like a nerve block in the back. Man, let me tell you, this doctor was so new. And, God bless her soul. She was so sweet. And she's like, I don't know how to do that. I'm going to have my supervisor come in. And I was like, say no more. Go ahead. Bring them in. Because they were scared of hitting the nerve and it could make my whole mouth go numb or my tongue go numb. Lawsuit. And I was like, I get it. And they had me sign a release. Read what you're signing. And I was like, no, it's fine. I'm in this much pain. I'm willing to take the risk. God bless it. Like, nothing happened. So she did the nerve block. She put lidocaine. She's like, it's gonna pinch. And I was like, it's okay. I don't care. I would rather take this nerve block than deal with it the whole weekend. And yeah, sure enough, it kind of coasted me. It faded out by Monday. So that was like a Saturday when she put it in. Monday comes. I had to work. And then at the end of the day, he did the surgery on me. And he was like, yeah, So when he cut, he told me, like, yeah, we can leave it alone. I can give you antibiotics and, painkiller. Like, no, doc, you need to cut it off. I need you to, like, tummy tuck that shit, cut it off, pull it down, stitch it up. And he was like, okay. And so, so my peeps were the ones who did it on me. And he uses this drug that's so freaking good. It's called Exparel. It's an anesthetic, long-lasting nerve block. So I was 4 o'clock in the afternoon. He does the little minor surgery on me. And later on I found out that he had actually cut into muscle into the back to be able to pull that skin flap, cut it off, sew it up nice and tight. So, and he mixed it with Exparel. So I freaking had to translate right after on a phone call. I was like, sí, señora, ¿cómo está? ¿Cómo le puedo ayudar? Okay, este día tenemos abierto, su cita es este día, blah, blah, blah. So I had to translate right after, and I'm like, because I was kind of numb. The next day, he's like, hey, how are you doing? You okay? And I was like, yeah. I kept working. I didn't even take a day off after that little surgery. I was like, let's go. It was fine because of the Exparel. So his technique, his suturing, his knowledge of the anatomy of the mouth. Mind you, my doctor is an oral surgeon. This is what he's trained for. He knows what he's doing. And he's an MD. So he's a doctor, MD, and a dentist. Oh, dang it. And an oral surgeon. Certified kind of thing. Right now he's taking his boards and stuff because he just graduated in July and it's, January 1st. All this stuff really gives him credibility because he says it all the time. Man, it was 14 years of school. It was freaking forever. And I was like, no, doc, an MD. So when he worked it was a Baylor University. Come on, guy, you want to get in? Go ahead. Go on. All right, good job. Trying to come into my lane. I get it, patience. He said that he's worked on major facial reconstructions, trauma, people who were on motorcycles who freaking lost half of their face. He's shown us pictures of people who lost parts of their nose and they have to take bone from the hip or the arm or the leg and just do bone grafts to build up what they no longer have because they don't have enough bone tissue to put the teeth back in or whatever. I'm like, damn. So people who lost their jaw, he had to reconstruct stuff like that. So when I'm like, oh, so he's like, yeah, this ain't shit. I'm like, Dr. Meta. He is such a millennial, or he's younger than me, obviously, and I'm just like, oh, it makes me laugh because he's just so candid, but he's also super duper, like, in front of the patients, like, oh yes, hello, like customer service, understanding, like, it's so cool, this new generation of doctors, and their understanding of what people want to expect. Like, this is, Yelp review, Google review type services, and like medical doctors before, I think it would be very it's a free-for-all, like, hey, I'm a doctor, like, you don't really have a choice where you go to. But now, like, you can look for, like, the best suited, best reviewed people to help you and take care of you and your matters. So he did the surgery. He did it. It was what was it, a Monday. I never stopped working. I freaking just kept working, never took a day off. And it's been like, now I think it's been like a month, because it was like what, I know the second row is like that. So after having dealt with it, now I tell people when they come in and they're like, oh, I'm scared, and I had a bad experience. Like, parents, they'll be telling me, like, for their kids, like, oh, I had a bad experience, and yeah, I was in so much pain. I was like, let me tell you about this guy. He is an MD. He's done facial reconstruction, so wisdom teeth, it ain't no thing. And they're like, oh my gosh, that's so good. And like, parents, they've even been like, oh my gosh, I'm about to get mine taken out, I think I'm gonna use him. And I'm like, yes, girl, yes, you need to, because I never stopped working. And I still like a little hinchada. I think I put it on my Instagram, because I was just like so grateful, free, because I work for him. Yes, ma'am. Yes, ma'am. So I was like, oh yeah. And I'm so grateful because, like, dude, the hospital ER couldn't do ish for me, because they're like, we're medical, we're not dental. And I'm like, man, it's crazy how those two are like separate worlds in the healthcare field, like completely separate. Like, it's like one or the other. So long story short, now I know that from my experience of going to my dentist and having them take out, and I had so much pain and swelling for like weeks, I lost 10 pounds because I couldn't really eat, to working for an oral surgeon and him doing things properly. I'm like, wow, like, it really matters. And there's things that you don't know because you're not in the field. And I feel like a lot of people don't talk about it, or it's like word of mouth, but just like to, the pockets of people that you know. So it's so important to have this knowledge out there. And I remember when I was doing nursing home, I was like, man, there is so many nooks and crannies about healthcare that people don't know. They don't know the process of the referral. They don't know that it takes 3 to 5 business days. The insurance that's regular timeline. Expedited is 24 to 48 hours. So everything would go expedited when I would send it. I really, please, expedited review, expedite. And sometimes people don't think like they can check that off, but it's like, if you need it done like ASAP, yesterday, expedited, because if not, you're going to wait 3 to 5 business days. How to call the insurance, how to request services, the kind of services you can request. And if you have an HMO, that just means that you have the government. I need to get into another video about that, because that's a whole thing. But there's so many things that I've wanted to like give as knowledge to the world, because it's so important and people don't know about it. And man, you know how many times I had to deal with families who were struggling financially, and they didn't know these steps that they could get through their insurance, and they were just like trying to freaking figure it out. Car washes, loans, donation. It's just like so crazy. And I want to make sure that people are, at least you have the option of knowing, okay, this is the way I can do it, or not. But I guess I'll get into that in another video, because that's really what I've been wanting. Oh man, I've been wanting to do that for years. I've told people for years, like, oh man, I want to do a YouTube. I want to freaking put this information out there. People don't know how Medicare and Medi-Cal work, how it can work for you, not against you. But people just don't know there's programs out there to cover stuff, Okay, well, I'm out. Happy New Year, everybody. Take care. God bless.